Hello, I'm Dr. Erin Newman, an OB-GYN on medical staff at Baylor University Medical Center, Dallas. Today I will be talking to you about preparing for pregnancy. As you prepare for or contemplate pregnancy, there are many things to consider. One of the most important elements is establishing preconceptual and/or early prenatal care in order to ensure the birth of a healthy baby with minimal risk for the mother. A discussion with your medical provider can help determine potential risks for you during pregnancy and ideally decrease or eliminate these risks. Optimizing the health of the mother before conception is important for improving pregnancy outcome. Establishing or maintaining a healthy diet and some form of exercise on a regular basis can improve fertility and pregnancy outcomes. Ideally, before conception, you should address medical problems or conditions with your doctor to potentially alleviate any possible complications. Remaining up to date on immunizations is also important and can decrease other potential complications to a mother and baby. Use of tobacco, alcohol, and illicit drugs is associated with poor pregnancy outcomes. It is also important to begin taking folic acid, ideally at least 1 month prior to conception. You can check with your provider regarding the proper dosage. A woman over the age of 35 is considered to be advanced maternal age. Women in this group are at risk of infertility, having or developing a chronic medical disease, and pregnancy complications such as fetal chromosomal abnormalities, congenital anomalies, cesarean delivery, miscarriage, and preterm birth. However, most women over the age of 35 have uncomplicated, healthy pregnancies. Knowing your family history is important to determine any potential conditions that may pose risk during pregnancy. Some disorders are genetic and can be inherited. Examples include metabolic disorders, muscular dystrophy, and kidney disease. Ethnicity can also play a part in risk assessment for pregnancy. There are medical conditions that tend to be more prevalent in certain ethnic populations. Examples include Tay-Sachs and Ashkenazi Jews, cystic fibrosis in Caucasians, and hemoglobinopathies in Mediterraneans, Africans, and Asians. Conception is the act of fertilization, resulting in an embryo or developing fetus. Most pregnancies occur in the first 6 months of couples attempting to conceive. The normal menstrual cycle averages 28 days, and ovulation typically occurs around day 14. Some women have shorter or longer menstrual cycles and will therefore ovulate earlier or later depending on this length. There are various methods to monitor ovulation. You can monitor your body temperature or certain symptoms that may indicate ovulation is soon to occur. Additionally, blood work evaluating hormonal changes or ultrasonography looking for certain features can be used to determine the presence of ovulation. During a typical menstrual cycle, the fertile interval is approximately 6 days, during which conception is most likely to take place. This time frame includes the 5 days before ovulation and the day of ovulation itself. Infertility is defined as failure to conceive after 12 months for women less than 35 years and 6 months for women over 35 years. There are many causes of infertility, some simple and some more complex. If you are having difficulty conceiving, you should discuss this with your medical provider. Once conception has occurred, pregnancy begins to produce its changes on the body, affecting most organ systems by the end of pregnancy. Changes in the respiratory system cause shortness of breath, cardiovascular system changes affect blood pressure, gastrointestinal system changes cause constipation and indigestion, and changes in the musculoskeletal system cause lower back pain. Most women will experience the majority of these common symptoms at some point during the pregnancy. During early pregnancy, even before you may realize you are pregnant, you may experience symptoms such as amenorrhea or the lack of menses, nausea with or without vomiting, breast enlargement or tenderness, increased frequency of urination, and/or fatigue. These symptoms illustrate the variety of changes pregnancy produces on the body, even at a very early stage. During pregnancy, adequate and proper nutrition is essential. Generally, you should aim to increase your caloric intake by around 300 to 500 calories per day. Additionally, certain vitamins and minerals are important, including folic acid, iron, calcium, and vitamin D. Taking a daily prenatal vitamin and eating a well-rounded diet can help with proper nutrition during pregnancy. Mild to moderate exercise is also important during pregnancy and encouraged. If already exercising regularly, you should continue. Check with your provider regarding safe exercise in pregnancy. Weight gain during pregnancy is variable and depends on your pre-pregnancy weight. For normal weight individuals, an average of 25 to 35 pounds should be gained. If a woman is underweight, she should aim to gain more, and if overweight, she should gain less. A woman at the upper or lower extremes of weight gain during pregnancy is at increased risk of pregnancy complications. In summary, as you prepare for pregnancy, it is crucial for you to address all medical problems and potential risks with your medical provider prior to conception if possible. Seek evaluation by medical provider if difficulty achieving pregnancy, and establish and maintain a healthy lifestyle and aim for appropriate weight gain in pregnancy. Pregnancy is a unique experience for every woman and couple. Individualizing care with your medical provider is recommended. For more information, visit baylorhealth.com/women or call 1-800-4-BAYLOR.